for any of you who I haven't had the pleasure of meeting, I'm Dr. Tom Porter. I'm the Director of Low Vision Services at St. Louis University in the Department of Ophthalmology. And I'm a clinician. What we're going to do tonight really is just have an open discussion for everything that you wanted to ask either a doctor or about albinism and for whatever reason didn't ask. What I put together was, and the slides only have these words, so it's really not going to be that helpful, are the questions that someone new to the low vision clinic asks me. And again, I wanted to see if this would stimulate some discussion. Um, I, I don't really plan tonight on just lecturing to you, but rather answering questions and just having an open discussion. And the first thing that I'm asked invariably is, could you explain in non-medical layman's term um, why I don't see like everybody else? And I always use the analogy of an archery target with a bullseye. In albinism, the macula, which is the center of the retina, that's what's in charge of color vision and detail vision. Doesn't form normally. It's called macular hypo. Hypo means low. It's a hypoplastic macula. So because of that, the um, the vision will be degraded. It won't be as sharp as someone who has a normal, healthy macula. Because it's a congenital condition, it's not going to get worse with time. Although I do caution everyone that those with albinism have the same risks as any other person that we see in clinic. For instance, one with albinism can have cataracts just like everyone else. They can have glaucoma like everyone else. They can have complications from systemic diseases like diabetes. Um, so I'm often asked again, well, couldn't you just give me stronger glasses to make me see sharper and crisper and clearer? And I see somebody shaking their head, and I totally agree with you there. Again, I'm full of analogies, and the one I like to use, although I guess with you younger folks, I'm going to have to come up with a better analogy. But I always think about a good camera with a bad roll of film. The eye itself um, uh, requires that healthy, normally formed retina in order to allow a pair of glasses to improve vision simply by refracting. So just because you make the glasses stronger doesn't mean the vision is going to be better. Another question I'm asked all the time is, why am I so light sensitive? And one of the things that happens in albinism is the iris, the colored part of the eye, doesn't form normally. And there are things that they'll actually be little transilluminated spots where if I shine a light from the side, the iris will actually light up and you can see little holes in it. So it's not preventing light to get in there. And then on top of that, if you add the melanin problems, then you're going to have way, way, way more photophobia. My next question that I'm asked all the time is, will I be able to drive? And I'm so happy to hear that you're going to have a bioptic webinar before too long. But the answer that I often give parents when they bring in their early teen uh, child is it kind of depends. Um, the vision regulations in all 50 states are somewhat different. Where I practice in Missouri, one can get a limited driver's license with visual acuity up to about 2160. There are other states where uh, bioptic telescopes are required for driving. Don't take your community eye doctor's visual acuity as the best that you're absolutely capable of. If you think about your visits to the eye doctor, very often they'll project a chart, and after one or two letters, then you find that you're not able to perform any better. But the eye charts that are used in low vision clinics are much more accurate on the end of the visual spectrum that's not quite as uh, quite as vigorous as the normally sighted folks. Um, so don't ever allow that issue with driving to be one that the door is closed until it's truly closed. Um, Another question that I'm asked very often is the question of legal blindness. Am I legally blind? And the definition of legal blindness is best corrected vision. That means with glasses, contact lenses, or whatever, of 2200 or worse in the better seeing eye, or a visual field of less than 20 degrees. Well, one of the great things about albinism is that it is not a disorder that constricts visual field. So we can throw that 20-degree thing out. If the visual acuity best corrected with glasses or whatever would be worse than 2200, then in fact, that would be the legal definition of legal blindness. Uh, Possibly your eye doctor can provide you with a document called a certificate of legal blindness, which can be used for various community benefits where I practice call a ride and some of there are benefits on utilities and things like that. I've got a dog trying to get here into the picture. Um, that um, a certificate of legal blindness helps with that. A good certificate of legal blindness actually has the Social Security definition in the form, and that can certainly be used if one is trying to get established with, let's say, a rehab services for the visually impaired or even disability payments. So again, certificate of legal blindness is often very helpful. Another question that I'm asked just continually is about nystagmus. What is nystagmus? And I think most of you know what nystagmus is. It's the rhythmic motion of the eye side to side, although it's not always side to side. There are cases of nystagmus that we see that are vertical, up and down, and even rotary, where it goes in circles. Nystagmus can be pendular, where it's side to side rhythmically, or it can be jerk nystagmus, where it goes slowly in one direction and jerks back the other. And that in and of itself is not diagnostic that there's anything that we need to worry about, especially in albinism. Um, Most of you have a null point, a point of head movement where you can slow that down. And if we're trying to get the best visual acuity for you for, let's say, qualifying for a learner's permit or something for driving, we want to give you a way that we can access that null point as best you can. Another question that I'm asked is about glare sensitivity and sunglasses. In fact, I just had a young lady with ocular albinism on Monday, and that was the question that I got a pair of glasses from the local optical chain, and I got number 3 gray sunglasses. And what many folks don't know, and it's important that you know this, a tinted lens is dyed, just like you're going to dye a sweatshirt. And the optical lab can make that tinted lens all the way down to 1 or 2% transmission. It's just one step away from being opaque. And those of you out there that are very photophobic, have that discussion with the place that makes your glasses and say, just standard number 3 tint is not dark enough for me. Can you help me? Most opticals will have just a whole variety of tints where you can hold it up to your eye and find the one that's the most comfortable for you. This is a little bit of a controversial thing, but there are some anecdotal um, things that have been given to me. That gray is not necessarily the color that my folks with albinism see best with. Sometimes it's a very dark brown. Again, that's subjective. You're going to find what you like. Um, so. Those are the typical things I have questions on day in and day out from my, oh, here's one too. Um, will I pass it on if I'm of an age to have children? And my answer just typically is a genetic study will tell you better. And genetic studies now have become very, very popular with all of us in the eye care field. It's no more than a saliva swab and send the sample off of both the male and the female, and they can come back with a profile that's very, very helpful for future generations. Okay, as I told Casey, this could be really a short one, or it could be a long one. But
Yes.
those are the things that I am asked most often in my clinic.
Yes, and we'd love to open up the discussion and take any questions. I know I see all of you in the waiting room. I know some of you are new to this community, either a parent or recently diagnosed. And I know some of you are adults who have had albinism your whole life and may just also still be here for just out of curiosity. I'm already getting two questions in the chat, Dr. Porter.
Great. I hope
So
there's
yeah,
20 more.
everybody keep writing them in the chat if you have any. First, someone asked, when you talk about the tint level, is that for prescription sunglasses or are those options in transition lenses also?
Okay, that's a great question, and I want to um, on non-prescription sunglasses. There's a company that many of you may know about. It's called NOIR, NOIR, and they have the widest array of pre-made sort of the wraparound slip over sunglasses. And I know specifically they have a tint all the way down to 2% and as high as 99%. Now, what those numbers mean, 99% means that 99% of the available light will get through the lens. 2% means it blocks out 98%. So there's something there. Prescription, on the other hand, is what I was talking about with custom dyeing. You go to the optical and you decide, I've got to get a pair of sunglasses to go along with my clear glasses. And those are custom dyed. Now, in the question, it said about transitions lenses. Unfortunately, transition doesn't give any of us the option of going any darker than what they're already made by the manufacturer. So a transitions lens is going to be dark enough, I think, for those who don't have albinism, but I question whether somebody with albinism would be completely satisfied.
Great. I'm going to take another question from the chat, and then after that, someone asked if they could ask a question aloud. And just for reference for everyone, if you would rather ask your question aloud, that is totally fine. But we do have another one I'm going to read to you. Chuck Huss, actually, hello, Chuck, said, "Can you share some information regarding Ray-Ban sunwear? Does it help persons with albinism? Do you know anything about that?"
Well, Ray-Ban is a brand name, and some of the styles are things that I think that my patients with albinism would like. You all know this. You're light sensitive. It comes with the territory. And you're light sensitive from both above and from the sides. I can't tell you how many times I've had a new patient in where I'll just say, does glare bother you? I know the answer ahead of time, but I'll ask them and they'll take their hands and they'll put it around their glasses like this and say, oh, yes. So a wraparound is great. Ray-Ban Chuck has many, many styles, but basically they're not available in the darkest tints. I wear a pair of Ray-Bans myself in their what they call their number 3 gray. And it's certainly an adequate tint for someone like me, but I just don't know that it would be something that would be the best. It would be okay, but I don't know that it'd be the best that we could come up with for our patients. Unfortunately, too many people in the entire eye care field don't know enough about albinism. They just don't, and I'm ashamed.
Thank you for all the good questions coming through. Keep them coming. For anyone just joining us, we are just asking Dr. Porter some questions. Um, and True, I will let you go now. True asked if she could ask her question aloud. So
Yeah. Hi, doctor. Thank you so much for doing this.
My pleasure.
So I wanted to understand nystagmus more. Like I didn't fully understand the whole null point thing. Could
Oh,
you describe that again for me?
Absolutely. So nystagmus is the eye movement. Traditionally, you think of it as going side to side, side to side. And if we had a research scientist in here, what I'm going to say next would make them cringe. But because we've got the macula that does not fully develop, if we can get the eyes to stop moving side to side and find a point where they aren't moving, the eye gets a little bit better acuity, a little bit sharper vision. The null point, and I'm going, if you can see me, I'm going to show you what I often see in my clinic. When I'll ask someone, I want you to just work as hard as you can without me giving any more guidance, they'll kind of move their head one way or the other. Sometimes it's down, but
Mhm.
there's typically a movement, and we call it the null point, where it'll really slow this down. Um, n-
Okay.
Nystagmus is I see it in very, very, very young children that have albinism. And it's not worrisome to us that it's characteristic of a different neurological problem, like it would be in a person who was normally sighted and one day came up with nystagmus.
Right. Okay. I think I remember hearing about this once. So you're saying like at a certain angle, the nystagmus is like lessened a little bit so that I can
It
focus easier.
right, it's minimized. It's absolutely minimized. And
Okay.
yeah.
To be honest, whenever I film myself uh with a camera, like I it's like I don't necessarily like want to like post a video because I'm a little embarrassed about like sometimes it'll just kind of go wild and I'm like, man, I wonder if there's a way for me to calm that down. I don't know. Is surgery an option or
So
what would you
So
say about that?
there are a few there are a few surgeons that um, will tighten the muscles, I guess would be an easy way to try and slow it down. And it has um, various successes. I do have one or two of my patients that have had this surgery, and I didn't see them before the surgery, so I don't know how much it's helped. Um, so
What's the name of the surgery again, you said?
okay, so. Uh, Wait, ask the question one more time.
What was the name of the surgery so I can write it down?
Oh, okay. So the surgeons that do this type of surgery are typically strabismus surgeons. They're the doctors that fix crossed eyes and that type of a childhood problem. There are some
Yeah.
that are what we call adult strabismus surgeons. In our practice, we've got two. And the idea is to shorten some of the muscles, and by shortening them, it tightens it up and may slow that nystagmus down.
Okay, that's interesting because that was actually going to be my next question about the strabismus because yeah, I have that. It was never corrected as a child, and I had an optometrist tell me that surgery was kind of like um not, it was likely to not work with me, and I don't want to get caught in a cycle of like continuously having surgeries and so I can live with it. It's not
So,
awful, but if there is hope, let me know.
okay, so we had a strabismus surgeon on our last Seeing Beyond. Um, Strabismus is sort of a very, very common surgical issue. They can straighten the eye out, at least cosmetically. When we're talking about nystagmus and trying to slow that excursion down, that gets a little trickier. And I would not expect a general eye doctor to be able to give you a lot of information. But I think it's, if I apologize, there are dogs in the background. I'm being rescued. Thanks. Thanks. we're dog setting, and you can hear the results. Okay, so I'm not encouraging you to have the surgery, but possibly I can even get someone to volunteer to do a question and answer on things like that in the future.
Awesome.
Okay.
Okay, we have a lot more
Okay.
in the
Um,
chat.
Okay.
So we're
I
gonna
have to
see.
give
could
a
I
shout
could
out
I
to one of
could I
my
ask
friends, Ian,
uh
Ian. Okay, let's go back.
could I could I ask one last question? I just
Certainly.
remember hearing one time that um our visual impairment is not necessarily explained by the fact that that we don't produce melanin, that we don't produce pigment. Um, do we like, I don't know the most current research or anything like that. Like, do we understand why we're legally blind yet?
Well, the reduced vision is caused by what I was talking about, the macular hypoplasia. Um, if you well, that's the crystal sharp vision area. And then if you Google a retina of one with albinism, you'd see that it's virtually not there. And that's really the part of the retina that's in charge of the sharp, crisp, clear vision. The lack of melanin really adds to it. The lack of melanin really is why you're so light sensitive, both the eye and the skin. So it's not just one thing, it's a combination of things. And I'm sure the researchers have way newer information. I'm speaking to you as a clinician. In fact, it's one more reason to come to NOACON in July, because we'll have
Thank you
some
so much.
researchers there.
All right, next question. Can you talk a little bit more about the lack of pigment in the iris? I understand that the iris lacks pigment, and I'm curious why it still appears to have color, like blue, light gray, purple, etc.
Okay, so in, some of these things really, I would encourage you to do a little bit of Google search on some of these words I'm going to throw out, and I think you'll see better. I don't understand better. So in albinism, the iris, the colored part of the eye, does not have normal pigment in it, and under a microscope, it looks in some cases almost like moth-eaten fabric, where there are areas where there is no pigment whatsoever. And the term you'd look up is iris transillumination. And one of the things that we do just routinely is shine a light from very close to the junction of the white and the colored part of the eye sideways, and it will show us how much um, um, iris transillumination there is. Um, and that certainly is one of the reasons why the light sensitivity is so great. It's just that light isn't blocked by the iris, like in a person that without albinism, but it actually passes through as well as the pupillary opening.
Great. Okay, next. I have an 8-month-old baby with OCA 1B. When we don't have evidence to support a need, does it still make sense to try glasses on a baby? Some of the research shows wearing them anyway, and maybe adjusting the prescription over time can help the brain communicate to the eyes and vice versa, which could help vision develop.
That that seems to be the opinion of our pediatric ophthalmologist is um, that it's worthwhile. So I don't I don't work with children below about age 5, but on a newborn like that, um, take the advice of your pediatric ophthalmologist. Be sure that you're going to a pediatric eye doctor for those visits and ask that very same question.
Okay, next, thank you, is what's the best solution for glare coming in around regular prescription sunglasses? I'm asking for children if that makes a difference.
Okay, read it again for me, Casey.
What's the best solution for glare coming in around regular prescription glasses, I guess, coming in from the sides.
Sure, sure. Okay, there's a number of things that I can offer. Um, I'm going to give a financial disclaimer. I have no financial interest in this company called No IR, but they have children's pre-made sunglasses that are wraparounds, that are wraparound style. There are so many wraparound sunglasses that are available today that I think we could find something for a youngster. There are prescription quality frames where if the youngster wears a prescription lens, they could be custom fabricated. But if you think about swimming goggles, they fully wrap around you. Well, the same idea for glasses. We want to eliminate that side and top glare, and the only way to do it is some sort of a wraparound. Kids get kind of tough, I'll tell you, um, because we're talking about a group of youngsters that really need eye care from day one on. And in those earliest ages, the less than 2 years, it's really, really tough to find uh, spectacle frames that do everything we'd like. In bigger cities, St. Louis is the size city I'm talking about. There's often an optical that has a specific section and a big section on just pediatric frames. Um, Here in our city, it would be either where I am or Washington University because we have big pediatric eye departments. Consequently, there's going to be a lot of pediatric eye prescriptions. So in those of you who are in rural towns, you may not have the access to it, but it's out there. It's available if you seek it out.
Great. All right. Um, I do see your raised hand, Wes. I'll get to you. We just have a lot of questions coming in. Next is there a connection between nystagmus and balance issues?
Um, I don't, I don't, I don't think that there's a direct connection with that. Um, New, there's always exceptions with new onset nystagmus, which doesn't is not typical in albinism. Yes, there would be, but I wouldn't expect that.
All right. Wes, you're muted, but I see your hand is raised.
Yeah, Dr. Porter, you mentioned earlier that it has to be worse than 2200 to be considered legally blind. So
Uh-huh.
I kind of wonder if you're right at 2200, so you're not considered legally blind if you're right at it, because, I just took a check a while ago, you know, because of my cataract surgery and myopia, I gotta get checks in one now and then. And without any other correction other than the IOLs, because I had cataract surgery before. I did have my vision peak up at 2150. So I don't know whether I'm really, much below the 2200 mark. I mean, so I kind of wonder if you're at 2200, you're not legally blind, you got to be worse than that, a higher number than that.
Well, the way the language is 2200 or worse in the better seeing eye. So if you are 2200, yes,
Okay, so it does say 2200 or
right,
worse. Okay, good. All right.
or worse, right. Now, and I'm there. There are different eye charts, and I'm just telling you, Wes, that you may score worse on some eye charts than others. And uh, I've had patients in that it would be to their advantage to be legally blind rather than not.
Yeah.
So, that's just an aside, but
Yeah. I,
2200 or worse.
I was I always been under the legally blind classification, and I
Uh-huh.
just think I'm about to lose it or anything, because of disability benefits and stuff. But
I I would bet that at tw the difference between 2200 and 2150 is not to be sneezed at, but on the other hand, if you've had benefits all this time because you had cataract surgery, doesn't mean that now you're going to be able to go out and buy a new Ferrari and take
distant portion of the lens of those that's doing 21-25 on his chart, it says that is within the range of bioptic driving, and he was confident he could get me up to 2040 in the telescope. I
Yeah,
haven't pursued it any because he says I should budget about $4,000 for the lessons and the bioptics. And it's kind of like I might have the money to do that, but I don't have the monthly income to afford the maintenance to maintain and operate a motor vehicle. So I'm kind of left on the back burner. But
yeah.
so
Um,
it's the M word right now for that, you know.
yeah, yeah. Okay. I understand.
All right.
All right, thank you.
Let's see. We have if you get some sunglasses from Noir, is it Noir? Is that how you say it?
NOIR.
NOIR. How would you know which number is best for you? Is there a way to know before you order, I guess, or
Unfortunately, well, it's one of these things where it's would be so hard to just look at a picture and say, "Oh, this is what I need." Um, I um, I'll tell you what, if Liam, if you are on here, would you speak up because you're the one person that I've met that's been able to figure it out about as well as anybody.
For the tints,
Yeah, like the question was how would you determine what's the best no IR tent?
like, yeah,
And
or their transmission numbers, maybe
right,
like the percentage of transmission.
right. Like I remember you and Sheila taking that whole ring of no
Yeah.
IR colors and doing that, but I don't know that every eye doctor's got anything close to that.
Um, yeah, I know they have a couple of, like I said, the 2%, 3% transmittance. Um,
What's the
and I think
lowest
there was a dark
transmission
green
that
one.
you find comfortable?
Um, I guess the orange and red
Yeah.
like seem more comfortable but brighter, but they have like a really dark green one that's seems like it has a higher transmittance, so it isn't as comfortable or something,
Okay.
or
Okay.
says it's lower.
So
But also like always getting the wraparound, and they have that gray frame that has the kind of rubber bumper in it that kind of blocks out.
right, right. Okay. So Liam has been dealing this for us long. God, I don't know how many years you and I have worked together, but it's been a long time. And I hate to say that to some degree it's trial and error. In our clinic, we have a ring of 100 different colors and densities, darknesses. And that's certainly the best way where you can look through one and say, ah, this is comfortable. But it's it's available in low vision clinics, not necessarily every eye doctor.
I like the 570 glare shield one, that kind of orange one,
Right,
I think. And that no IR is good because it blocks like the non-visible um wavelengths, because we've tinted my prescription glasses from the Dr. Porter's optician, and it's like the right orange color, but it's not the same as no IR because it's just kind of tint matched. It's not the no IR where it only allows the visible wavelengths.
right, right.
But they do have that glare shield, like 570 is pretty good without being too red to be monochromatic, where it cuts out the color vision, but it's kind of a good in between orange.
And if y'all listen to Liam, he's not saying gray. The colors that are most comfortable are very, very often away from the gray spectrum.
It's hi, I'm Q. I'm the one who asked the question. I was asking that because most of the time I get the wraparounds from Walmart, and those don't even help. The light still bothers me when even with the shades on, I still can't really see like I want to.
I so um the the sunglasses we keep talking about over and over and over again, you can buy them online. You don't have to necessarily go to an eye doctor. The thing that's the trickiest is how dark do you want them to be? And they're talking about Walmart. They're much, much, much better than Walmart, and they're not terribly expensive. It's
Okay.
these this
Yeah,
comfort.
that's what I'm looking for. I'm just looking for the right tint because, like I say, the one at Walmart, they're dark, but they don't be good enough for me to wear still in the daylight.
I'll tell you a funny story. Over the years, when I see a new patient, before they come in, I'll say, I want you to bring every pair of glasses, whether they're helpful or not, sunglasses, whatever. And when we start going through the sunglasses, they're actually all the same color, gray, and just different densities, just different darknesses, but none
Mhm.
of them are anywhere close to as dark as what most folks with albinism need.
Okay. Okay. I'll definitely check out the website. I had already looked at it, but I was like, how can I tell which one to get just by
Well,
looking at the website?
that's the tough part.
And just to kind of add to that, and let me know what you think, Dr. Porter. But I think it's also that they have to be advertised as polarized because that's what blocks out the UV. Like it has to be specifically like polarized sunglasses. So it can be very dark, but not polarized.
Uh,
Okay.
Just
Yeah.
you're correct in that you want to make sure that in the description that it says ultraviolet blockage, UV blockage.
Okay. I'll definitely check out the website. Like you said, I just have to do trial and error until I get my eye appointment.
I understand. Sure.
Kathy,
Thank you.
you have something?
Yeah, I do. This is Kathy. And I first of all, I go against the grain because I actually do really like gray fit over
Well,
sunglasses, and I get the darkest gray that I can, and those help me a lot. I don't typically like the yellow or the amber because I just don't like the yellow t I mean the brown or the amber because I just don't really like yellow light. I want everything to be kind of like daylight. But also I think I would be curious like for people to go to their or talk to their low vision specialist or their eye care professional about going into the office and trying some of these out because like a low vision clinic I and Dr. Porter, you would probably know more, but in my experience, where I am and taking students, I'm a teacher of the visually impaired, so taking students there is a place where you can try things out. And I've gone several times and tried different kinds of sunglasses and also tried colored contact lenses. And I was able to try on a pair and wear them inside and outside for a little while to see if they made a difference in my photophobia and things like that. So, rather than just trying to spend a bunch of money guessing and then guessing wrong, you can try to maybe like talk to those people and see if there's ways for you to go try some things out before you commit to buying something.
Kathy, that's absolutely correct. That's what I encourage everyone to do. Um, there's there's really no way that I can give you a blanket recommendation on how dark they should be or even the color. If you listen to Liam, he's found the ones that work best for him. And Kathy, you have too. But uh, one of I'm getting off on a tangent, but just bear with me for a minute. Um, if you don't have a normal macula, then you have a side issue called contrast sensitivity loss. Contrast sensitivity is your eye's ability to visually separate what you want to see from what's behind it. And a silly analogy I use is I've got a white dog, and on a snowy day in the backyard, I can't find him, low contrast. Certain lens tints enhance contrast. Certain lens tints actually reduce contrast. And gray, it doesn't enhance it and it doesn't decrease it, which is why gray is so popular with the normally sighted folks. Um, Liam, when he was describing all these lenses he likes, it's because he somehow or the other appreciates the contrast appreciation. But yellow gives all the contrast enhancement you could imagine, but no glare protection at all. So, it's not one that I would certainly start anybody off with albinism. So I applaud what you said there. And yes, the best way to do it is be able to see it and try it in your own hands.
Well, that makes a lot of sense too, because it's hard to quantify like put into numbers light sensitivity and contrast sensitivity. And I know that there are tests for contrast sensitivity,
Right.
and you get that issue with a lot of other eye conditions as well. But it's almost like you kind of have to figure out each person has to kind of figure out what's the lesser of two evils, right? So like somebody with albinism who has really, really high photophobia and doesn't struggle with contrast may prefer one lens over the other. Whereas if somebody with albinism, they have a type that where their photophobia is not as bad, they may really notice, oh, these make a big deal for my contrast sensitivity, and I'm going to pick those or whatever. So I think I'm glad you said that too, because I think it's a really good point that it's that whole I and IEP, right? Like everybody's different, and you met one person with albinism, and you've met one person with albinism, you know?
Right, exactly. And an eye doctor who's examined one patient with albinism has examined one patient with albinism. And I've been fortunate in my career to literally do hundreds, if not thousands, but each and every one is different. For I'm so committed to the albinism community. A lady doctor, a colleague of mine that I had for 7 years, had albinism. And, she would always say, no, you can't make these blanket statements. I'm different than anybody else. And from all of you guys over the, I don't know, 15 or 20 years I've been associated with you, I've learned a heck of a lot, but I've also learned that I've got a lot to learn.
Karen?
Hi, Dr. Porter. I just wanted to kind of go back to one of the things you said in your opening was that we were talking about bioptic driving, and you said
Uh-huh.
sometimes not to consider your community eye care professional as kind of the end all be all authority. And as a low vision professional, I understand what you're saying there, but I was wondering if maybe you could, and I think that's kind of coming up in the chat too, maybe explain why you wouldn't want to have them consider that? Because could someone's vision actually be tested differently by a low vision professional?
Sure. Um, on on a standard eye chart, and all of you have looked at an eye chart, there's a big E, and that's 2400. And then the charts vary by what's next. It'll be the one that I'm thinking of, SL. Well, that's 2200. And then the next one is BPLO, and that's 2100. Well, wouldn't you think that there is some measurement of your visual acuity between 2400 and 2200 and 2200 and 100 and on down the line? There are charts that filter visual acuity much, much better than the standard chart that every eye doctor has. So, one of the things I encourage someone, specifically if we're talking about driving, is you need to find out what your visual acuity really is. Because if you're going to one of my tens of thousands of colleagues and they throw that chart up and they say, can you read the big E? Yes. Can you read the next two? No. Well, or maybe yes, you can read the next two, but not the next four. Well, you're in between there. And that needs to be determined. The state I practice in, with glasses alone, if your visual acuity is 2120, you can obtain a driver's license that allows you to drive daylight only, which I always laugh at albinism. It's like, yeah, let's put them out at high noon for daylight only driving, but still, I'm not going to fight that battle. And local roads. And if your visual acuity is 2160, they'll still issue a limited license, daylight only, 45-mile-an-hour roads and 15-mile radius of your home. So for that patient, the difference between 2200 and 2100 may be the difference between still getting to the grocery store and the drugstore and your church and on and on and on and on. So I think I beat that one to death, Karen.
Thank
Thank you.
you.
But I do have one other question I had. When you were talking about obtaining a certificate of legal blindness,
Yes.
just to kind of say it one more time so it's in the transcript for the call, not all persons with albinism are considered legally blind.
Oh my Lord,
Yeah.
absolutely not. I listen, I have had patients that have albinism that see as well as 20/25. I mean, and I've seen patients with albinism that are 2,800. It is such a spectrum. I almost think that maybe there's more than one disorder that we're putting under the umbrella of albinism because there's such a visual variation. But absolutely, just because I'm thinking about you, new parents, just because your youngster has albinism doesn't mean that they're legally blind or going to be legally blind. Absolutely not. In fact, this is I way more of my albinism patient base are not legally blind.
Well, and in my experience, and I think Wes might be kind of he had mentioned this as well with having his cataract surgery, if you go to a low vision professional and because of the different types of testing, your vision is actually often tested better, quote air quotes there everyone, better by a low vision professional than it would have been at a community eye care professional.
I I totally agree.
Yeah.
And kind of on this same topic, Anne in the chat was asking, so is it like a Snellen but with more lines to give more intervals? Still letters on a chart though, when it's between 2200, 2100, that it's still letters, right?
So Casey, I use three different charts in the office. Um, and and you have to understand that 100% of my patients are not patients with albinism. So sometimes we'll use that standard chart, the Snellen chart that you're familiar with. There's a chart called an EDTRS chart, early treatment for diabetic retinopathy study. And it's a very, very standard clinical chart. Any clinical research, that's the standard, that's the gold standard. It's not the best low vision chart, but it still is. But the beauty of it is it's on a big stand where you can wheel the chart closer to a person. So, but most low vision clinics will use a chart called a Feinblum chart, and it's a flip chart where each page has a different character on it. And again, where that chart is from the patient indicates what the acuity is. Let me use an example. If at 10 feet somebody can read the 2200 character on this little flip chart, at 5 feet they ought to be able to do the 2100. Now that doesn't mean we're going to write down 2100 for your vision, but it gives me the ability. I get patients that the report from ophthalmology will say their counts fingers at 3 feet. Well, no, their visual acuity is 2800. As horrible as that is, it gives me the opportunity to do things, maybe read their mail or their bills or a food package or a medicine bottle, but something that helps them maintain their independence. And in no way, shape, or form are they counts fingers at 3 feet or hand motion or all these other things that I hear. I'm sorry, I get off on a rampage sometimes.
Great. I think we have time for maybe one or two more.
Sure, I'll stay until 9 o'clock if that's okay with everybody.
Absolutely. About 5 minutes. Anybody else?
No?
I
Okay.
do have one more comment I want to make. So
Okay.
we recently Noah kind of hosted Adult Weekend, and we had a lovely presentation by Kathy Garza, who happens to be on the call. But one of the things that kind of was a big aha moment for some people in the room was the difference between our actual eye condition of, as far as refractive error and our albinism. And I think the difference, and I think Kathy, you put it very well that not everybody wears glasses because glasses don't help everybody, just like everyone without albinism doesn't wear glasses because they don't help anybody, or some people. It has to do with more of the shape of the eye. if you would unmute and kind of just
Yeah, I was saying
give that.
some of us just got double lucky with our eye problems. And so we have, problems with the shape of our lens and cornea in addition to problems with our macula where all those that high concentration of 20/20 cone cells or whatever are supposed to be.
Yeah.
Um, so that's why, well, and you touched on this too, Dr. Porter. This is one of the things that this is like my nemesis is those blanket statements on, especially like on social media, in groups on social media, because glasses is a big one. And, there's a lot of controversy about, well, you shouldn't, wear glasses if they don't help, or you should wear glasses. Everybody benefits from glasses. And it's not necessarily the case like you mentioned before, and because it could be your albinism, but it could also be other issues in your eye that would cause you to need those prescription lenses as well.
Yeah. Yeah. It's kind of funny. I'll get these 5, 6 year olds, and mom will bring them in, and they'll say, the pediatric eye doctor prescribed glasses for him, but he just won't wear them.
You won't wear them
And if
because they're
his,
not helping him.
I was going to say, if his visual acuity is the same with and without, that kid's smart. He's going to say, "Oh, this
Yeah.
isn't doing anything. Why do I have to go through the aggravation of glasses?" I, I can argue the idea that depending on the type of prescription, farsighted,
Right.
nearsighted, all that, that it may reduce the amount of focusing that you have to do it close and things like that. I can argue that point, but I understand the kid when they say it doesn't help a bit, and I'm not going to do it. And
Mhm.
that's a battle that the parents aren't going to win.
Well, and sometimes with little ones, it's really difficult too because they don't have the language to tell you what they can and can't see. And so I don't want to derail. This might be a topic for another call, but like when you were talking about the nystagmus surgery, and I would hear so many people talking about, well, my 1-year-old, my 2-year-old, my 3-year-old had nystagmus surgery, and a year later they are performing so much better on these charts. And it's like, well, they also have a year's worth
Yeah.
of more language. So how do you quantify that? How do you, not that I'm not saying that the surgery is bogus and doesn't work, but I'm just saying I think there's a lot of factors there, to consider.
Yeah, absolutely. One of the statements I make to parents, and I hope you guys chuckle at this. We'll get a baseline visual acuity of what we think it is at, let's say, age 5. And I'll tell the parent, I expect the visual acuity to actually be a little bit better in a year or two. And
Hmm.
why? Because their language skills are better. Let's say they've got a null point and they figure out how to access the null point. There's something called blur interpretation, which is figuring out by filling in the missing parts. So it's very, very common as a youngster goes through school to a point that whether they're with glasses or not, that their acuity
Well, and they've
goes up.
also had a year's worth more of experiences, right? Like if you look at typically developing children and how their first holiday season is when they're 1 or 2 years old compared to when they're 3, 4, and 5, their engagement in that is a whole lot different. And so vision is the same, right? Like if you're a 2-year-old or a 3-year-old kind of beginning your language journey, and then at 4 and 5, you've had all these other experiences and been to all these other places and develop those concepts, like, yeah, you're going to appear to see much better, you're going to
Yeah,
function better. Like we
yeah.
were talking in the chat about functional vision.
Well, I don't want to go on and on and on because I know you folks have other things to do tonight. But um, if I have two adults, one same age, same visual acuity, but one had normal vision all their life and they have macular degeneration. And I have somebody with albinism, the same acuity, same age, same this, same that, everything I can match up. The person who lost their vision is visually impaired. The person with albinism is visually challenged. And it's just a night and day difference. This is something that because of the cards you've been dealt, you get very, very, very good at using the vision you have.
Absolutely. So you're saying people with albinism are just very talented and adapt. I'm just kidding.
It's
Also
part of the
not.
genetics, Casey.
It's part of the
Somebody needs to
genetics.
do a
We're just
research
very
session on that.
adaptable people, very smart people.
Oh, very, the smartest I've ever worked with.
That's it. That's it.
And the company we keep is very smart too, aka Dr. Porter and many others on this call.
Yeah,
But
I was very fortunate to be in the right place at the right time
no,
to get it
we're
all.
so grateful. We were very fortunate. Yeah, this has been awesome. True said in the comments, the conversation is healing my soul. So I think that's a
Good.
good way to put it. I think this was great. Of course, this is a series, the Seeing Beyond series. Dr. Porter is not done with us. He can't run from us. We are going to keep inviting Dr. Porter back as much as possible. And this is recorded, so it will be up on YouTube and our website. If you'd like to revisit it, we'll also email you the recording as well if you'd like to revisit this. I know we could have kept going, but we're gonna just respect everyone's time, and we will have Dr. Porter back. So don't fret. He will return. And thank you so much, Dr. Porter, for your time and your knowledge. And we're always learning new stuff every day, so it's amazing. Thank you so much.
I apologize for the interruption with the dogs. And my final statement is NoahCon, July next year. I don't have the dates, but in beautiful Columbus, Ohio, right?
Yes,
Okay.
yes. The dogs didn't bother us at all. That's totally
Okay.
fine. But
All
yes,
right.
July 16th through the 19th, Columbus, gonna be awesome. But thank you everyone for coming. We really appreciate it. And I hope you have a great night and that you'll join us on some of the upcoming calls. Be looking on the website to see what you want to come to. And thanks everybody. Have a good one. Thank you, Dr. Porter.
Thanks,
Thank
Dr. Porter,
you.
and everybody else.
Bye.